Good morning, everyone. So, my topic for today is all about the effect of aging on the joint. So, no matter how healthy a person is, as they age or as we get older, our joints will show some changes in mobility, due in a part to changes in the connective tissue. So, first, let me define to you what is aging. Aging is a gradual, continuous process of natural change that begins in early adulthood. So, it is a natural phases of a human life and it is the process of getting older. We know that as we get older, we usually get wrinkles, freckles, blemishes, and other skin condition that triggers premature aging, or our skin becomes dry due to collagen reductions. So in connecting to joints, our joints also get aging. And to this topic, we will know how our joints gets aging as we get older and its preventative measures against the effects of aging on the joints. So let's tackle a little bit more understanding about joints. So what is joints? A joint is the part of the body where two or more bones meet to allow movements. Joints are the areas where two or more bones meet, and its function is it hold the skeleton together and support movement. Joints also have a very impressive functions in your body because it holds the skeleton together in allowing us to move a movement, for us to do a work, walk, jump, and many more activities that requires movement or motion. So, as we get older, a number of changes occur within our joint, which often worsen the symptoms of common joint diseases and disorders experienced by people of all ages. So, as we go further to this topic, we will discuss the symptoms of common joint diseases and disorders. So, those that occur in synovial joints have the greatest impact and often present major problems for elderly people. So you might wondering what is synovial joints. So what is synovial joint? A synovial joint joins bones or cartilage with a fibrous joint capsule. Synovial joints achieve movement at the point of contact of the articulating bones. Synovial joints also allow the bones to slide past each other or to rotate around each other. And also it is characterized by the presence of an articular cavity filled with synovial fluid surrounded by a joint capsule. So let's define what is synovial fluid to understand more about synovial joint. So synovial fluid, also known as joint fluid, is a thick liquid located between your joints. So the fluid cushions the ends of bones and reduces frictions when you move your joint. So as you can see in that pictures, that color blue with matching light black is a synovial fluid. So the synovial fluid in the joint capsule has important functions. So first one is it keeps the bones slightly apart, protecting their cartilage coverings from wear and tear. Second one is it absorbs shocks, again protecting the cartilage. And lastly, it lubricates the joint, helping it to work freely and easily. So in general, as a person ages, the tissues of the body become less flexible and less elastic, in part due to changes in protein structure caused by age-related modifications that cross-link proteins together. So when we say less flexible means is that not be able to do something or perform. So our body tissues will not be able to perform when we get older. And also the tissues in the body becomes less elastic. These changes are most prevalent or well known in long-lived proteins such as collagen, which is abundant in fibrous connective tissue. So we are all familiar with collagen. So let's have a small grasp. What is collagen? So collagen is a protein that provides building blocks for many of the body's tissues, such as bones and skins. It allows tissues to stretch and be flexible. So as people age, collagen production naturally decreases. So hence, the flexibility and strength of tendons and ligament decrease also with age. So the flexibility and strength of our tendons and ligaments weaken as we get older. So tissue repair slows as cell proliferation rates decline and the rate of new blood vessels development decreases. So these general changes can significantly affect synovial joint. So our tissues needs repair because it is essential mechanism to maintain the integrity and function of the body in response to a variety of both acute and chronic injuries and disease states. So these general changes, which is that tissues repair slow as cell proliferation rates decline and the rate of new blood vessels development decreases, can significantly affect synovial joints. So, di ba, ang synovial joint kay it allows the bones to slide past each other or to rotate around each other. In addition, with use, the cartilage covering articular surfaces can wear down also. So this articular surface is a joint cartilage. So in a joint, hyaline cartilage is referred to as articular cartilage. So this is because the cartilage covers the bone surfaces where they articulate or meet to form the joint. So when a person is young, the production of new resilient matrix compensate for the wear. However, as a person ages or get older, the rate of replacement declines and the matrix becomes more rigid. So thus increasing its rate to wear down, the production rate of lubricating synovial fluid also declines with age, further contributing to the wear of articular cartilage. So furthermore, the ligaments and tendons surrounding a joint shorten and become less flexible with age, resulting decreased range of motion. And as we get older, our muscles, which is strengthen our joint, also tend to weaken. Diba, as you can see, many older people are less physically active, which causes their joints to become less flexible and decreases their range of motion. Kumbaga, hindi sila masyadong gumagalaw compared to the young one. So let's move to the representative diseases and disorders of joint. So first is arthritis. Arthritis is a disease that affects your joint areas where your bones meet and move. Arthritis usually involves inflammation or degeneration which to breakdown of your joints. So these changes can cause pain when you use the joint. Arthritis is most common in the following areas of the body, which is our feet. So the next one is osteoarthritis. Osteoarthritis is the most common form of arthritis. Some people call it degenerative joint disease or wear and tear arthritis. It occurs most frequently in the hands, hips, and knees. With osteoarthritis, the cartilage within a joint begins to break down and the underlying bone begins to change. So the third one is rheumatoid arthritis. Rheumatoid arthritis is a chronic, progressive, and disabling autoimmune disease. It causes inflammation, swelling, and pain in around the joint and can affect other body organs. Rheumatoid arthritis usually affects the hands and feet first, but it can occur in any joint. So the fourth one is gout. a group of metabolic disorders that lead to increased production and accumulation of uric acid crystal in tissues, including joint capsules, so it can lead to arthritis. The next one is Lyme disease. It caused by a bacterial infections that affects multiple organs, including the joint, and it can lead to chronic arthritis. So the next is bursitis. Bursitis is the painful swelling of a small fluid-filled sac called a bursa. Inflammation of the bursa, often due to forceful contact or prolonged contact, such as student's elbow from leaning on a desk. The next one is bunion. Most bunions are deformation of the first metatarsals, which is the great toe. It occurs when some of the bones in the front part of your foot move out of place. So this causes the tip of your big toe to get pulled toward the smaller toes and forces the joint at the base of your big toe to stick out. So example, kay wearing a tight shoes. So next is tendinitis. Tendinitis is a condition where the connective tissues between your muscles and bones become inflamed. Often caused by our repetitive activities, tendinitis can be painful. It commonly happens in the elbow, knee, shoulder, hip, Achilles tendon, and base of the thumb. Next one is dislocation. Movement of bones out of their correct alignment at the joint. A partial dislocation is a subluxation. Means subluxation has been defined medically as a partial abnormal separation of the articular surface of a joint. Next is sprain. Sprains are injuries where a ligament is stretched or torn within a joint. Common places you might have a sprain can include your ankle, knee, and wrist. And lastly is chondromalacia patella. Chondromalacia patella, or also known as the knee pain, is the softening and breakdown of the tissue, which a cartilage, on the underside of the kneecap or the patella. So ligaments of the ankle joint. So as you can see in the picture, it has a medial view and the lateral view. So first ligament is medial, is thickening of the medial fibrous capsule that attaches the medial malleolus to the calcaneus, navicular, and talus. It is a deltoid ligament. Second one is anterior talofibular, extend from the lateral malleolus to the neck of talus, fuse with the joint capsule. Calcaneofibular, extend from the lateral malleolus to the lateral surface of the calcaneus. It separates from the capsule. Long plantar, it extends from the calcaneus to the cuboid and basis of metatarsal bone 2 to 5. Fifth ligament is plantar calcaneocuboid, extend from the calcaneus to the cuboid. And lastly is plantar calcaneonavicular, or short plantar. It extends from the calcaneus to the navicular. So as we done discussing the effect of aging on the joints and other representative disease and disorders of joints. So in addition, the most effective preventive measures against the effect of aging on the joints is to strengthen the bones and muscles and maintain flexibility. So this can be accomplished through a combination of regular physical activity, stretching, and a healthy diet. So if you are not engaged in a physical activity, you should change your lifestyle, engage yourself in regular activities such as getting a proper exercises, and balance your healthy diet for you to have a strong bones and muscles, especially your joints, for you to be ready when you become old. Thank you everyone for lending your ear. So I hope you understand something, and God bless everyone.